Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Duke Activity Status Index assesses functional capacity related to cardiovascular health by evaluating a patient's ability to perform daily physical activities. It measures physical functioning through self-reported ability to conduct tasks such as walking, climbing stairs, and light housework. The main purpose of the index is to estimate peak oxygen uptake and functional aerobic capacity in patients with cardiac conditions, including coronary artery disease and heart failure. It aids clinicians in risk stratification, treatment planning, and monitoring of disease progression by providing a standardized measure of exercise tolerance. The Duke Activity Status Index is indicated for adult patients with cardiovascular disease, including those with coronary artery disease, heart failure, and pulmonary hypertension. It is particularly useful for individuals undergoing cardiac rehabilitation or functional capacity assessment. The tool evaluates self-reported functional capacity based on daily activities, correlating with peak oxygen uptake measured during exercise testing. Its clinical utility is most pronounced in outpatient settings to monitor changes in functional status over time and to guide treatment decisions without the need for exercise testing. The Duke Activity Status Index consists of 12 items that assess a patient's functional capacity based on daily activities. Each item presents a specific physical activity such as personal care, ambulation, or strenuous exercise. The response format is binary, requiring a yes or no answer to whether the patient can perform the activity without difficulty. Each affirmative response corresponds to a weighted score, reflecting the metabolic equivalent of the task. After completion, individual scores are summed to yield a total score ranging from 0 to 58.25. Higher scores indicate greater functional capacity. Scores between 35 and 58.25 suggest normal to high functional capacity, whereas scores below 25 typically indicate reduced capacity, possibly related to cardiovascular limitations. Scores between 25 and 35 suggest moderate limitation. This range assists clinicians in evaluating cardiovascular function and guiding treatment strategies. The Duke Activity Status Index demonstrates a sensitivity ranging from 75% to 85% in identifying patients with reduced functional capacity consistent with cardiac impairment. Sensitivity refers to the tool's ability to correctly identify individuals who truly have decreased functional capacity. For example, a sensitivity of 80% indicates that 80 out of 100 patients with impaired cardiac function will be correctly detected by the index. Specificity of the Duke Activity Status Index varies between 65% and 75%, reflecting its ability to correctly exclude individuals without functional impairment. A specificity of 70% means that 70 out of 100 patients without cardiac limitation will be accurately classified as such. These values suggest that while the Duke Activity Status Index is effective in screening for functional capacity limitations, some false positives and false negatives may occur in clinical practice. The Duke Activity Status Index was originally developed in the late 1980s by Hlotke and colleagues as a self-administered questionnaire designed to estimate a patient's functional capacity based on their ability to perform various daily activities. Validation studies have demonstrated a strong correlation between the Duke Activity Status Index scores and measured peak oxygen uptake during cardiopulmonary exercise testing, with correlation coefficients reported as high as 0.85 in patients with cardiovascular disease. Subsequent research has reinforced its reliability and validity across diverse populations, including those with heart failure and peripheral arterial disease. The index's predictive value for morbidity and mortality has been supported in longitudinal studies, where lower Duke Activity Status Index scores were associated with higher rates of adverse cardiovascular events. Its ease of use, combined with robust psychometric properties demonstrated through test-retest reliability and construct validity assessments, has established the Duke Activity Status Index as a credible tool for evaluating functional capacity in clinical and research settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.